Okay, good morning, everybody. Hi, I hope everybody's okay. I hope you're not totally fed up with seeing me. I am not Geeta Rao Gupta, as you know. I'm Kim Dickson. I'm here on behalf of Geeta and UNICEF because unfortunately she got called away. I wish I was Geeta Rao Gupta actually, but I'm not. So I'll do my best to do justice to this presentation. But as I go through, just to say there are a number of people within this room who probably even know more than I do on the UN Commodities Commission. And so we'll be well served if you have questions or issues. So I'm going to talk about the UN Commission on Life-Saving Commodities for Women and Children. Now, better get, yeah, no?
Next. Yeah.
There we go. All right, so the, under the Every Woman, Every Child banner, which was the UN Secretary General's Commission for Women and Children, there were two main commissions that were established. There's the Commission on Information and Accountability, which was led by WHO and actually ITU, the International Telecommunications Union. And under that particular commission, there was the President of Tanzania and the Prime Minister of Canada. And this really was to bring together the issues around how we are more accountable and more transparent in our reporting. And I'm going to focus on the Commission on Life-Saving Commodities for Women and Children, which was established last year. UNICEF and UNFPA were the secretariat. We had the commission chairs were President of Nigeria and the Prime Minister of Norway. Now, yesterday, you heard on the panel where Liz Mason gave a very personal story about there being no devices or equipment. And I made the remark, what do you do when there are no devices or equipment and supply? You establish a commission. That's what the UN does. We establish a commission to try and move the issue forward. And I'll tell you about the commission, and I'll tell you how it has actually tried to move this issue around supplies, drugs, and commodities and bring it more to the forefront. There were 20 commissioners. And these were high-level commissioners. I won't go through all the names, but just to draw to your attention, these were very high-level people. We had a range of private sector, academia, the ministries of health, and also foundations represented there. And also importantly, we had bilaterals represented there. So the issue really was to get a wide range of key stakeholders at the highest level represented on the commission so that we could really bring the issues much more to the forefront. The objectives of the commission, what was it set up to do? It was to identify the opportunities to increase the production, supply, and use of high-quality, high-impact commodities for women and children's health, and there were a variety of ways to do that. To propose innovative strategies to support high-burden countries, to rapidly increase access to overlooked commodities, I'll come back to that, and to recommend strategies to raise awareness of and demand for. So the commission really was not only to look at the supply and regulatory issues, but also to focus critically on issues of demand. So we established criteria for identifying these underutilized commodities, because we needed to really come up with a short list of commodities. And the criteria were to look at high-impact, effective commodities. So there are a range of commodities out there, but for maternal newborn health, which commodities, if even given a slight push, could have a high impact? Those that were inadequately funded, because we already have the Global Fund, we have Gavi, for example, and they're dealing with commodities as well. But there are some commodities that have been left out. So look at more the orphan commodities, and those commodities that had untapped potential. With just a little push, how could we begin to raise the impact of these particular commodities? Based on that, came up with a short list of 13 life-saving commodities. And I would like to mention that there's some people here who lobbied. We're in South Africa, so I'll say they even toyed to get some commodities increased there. So don't look at me, Joy, but I'm not mentioning any names, but we pushed and we got commodities in there. So as you can see, 13 commodities across the wide range of reproductive, maternal, newborn, and child health. And out of those, we have 4 for newborn health. And let me just focus on those a little bit, because we're here for newborn health. But it's important that, as we heard yesterday about the continuum of care, that we recognize that this was across the spectrum of the continuum of care. For newborn health, we had, and also, just as I mentioned in newborn health, very much related to the major courses that we're addressing in this conference here. We have injectable antibiotics to address the issue of newborn sepsis, antenatal corticosteroids, chlorhexidine, and resuscitation equipment. What is nice also about this particular conference is that we have sessions. We go, this evening, for example, we have a session on antenatal corticosteroids led by Joy. Go to that session. Don't ask me any questions on antenatal corticosteroids. Go to the session this evening, and Joy will answer them. You have a session on chlorhexidine. Go to the session, and Pat Kofi. Pat, are you here? Are you here? Well, she's somewhere here. She will answer your questions on that. A resuscitation equipment, Lily's right here. Anything you need to know, you ask her. We also have Tori Ladal. Well, yesterday I should have said, if you don't have a bag and mask, what do? You call Tori. So please raise your hand. They're also here. Any questions, ask them. So ladies and gentlemen, don't ask me any questions. I'm a bit tired today. You ask all these beautiful people. They know much more than I do. There were 3 work streams for the Commission's working group. But just so to show you, because some of us are not actually in the pharmaceutical field, but we looked at what we call the cycle for that drugs should actually go through. You have the end user, and you can start anywhere. The end user who has to demand, or if there needs to be a demand for drugs. Then when they are manufactured, there needs to be a regulatory system so that they're well regulated and they get into a country. There needs to be a system for procurement of the drugs, and they need to be distributed well distributed within a country so that people get access to the drug. And it could be a vicious cycle, because if you break the chain along any of these, then these drugs don't get used. Now, the streams of work of the Commission were around market shaping, regulatory issues, distribution, access, and demand. So we have the whole issue of the supply. You have to shape the global market if we're to get these drugs out. They have to be well regulated within countries, and then you have to have your distribution to ensure people have access, but then people have to demand these drugs, otherwise you don't get them manufactured. So just to show you how the Commission was set up. Some cross-cutting barriers were identified, and then there are 3 main cross-cutting barriers around the regulatory issues. It's been identified that many developing countries do not have the regulatory capacity to ensure registration of essential commodities. There's low quality of medical commodities in the marketplace. I know, for instance, around the issue of misoprostol, it was recognized that it's there, but when they were actually, the drugs were tested, it was found that some of them were completely ineffective. The quality was not of good quality. There's market failures. It's a vicious cycle in which manufacturers expect that investment in certain products will not result in large sales and profit, and if they're not going to get large sales, they won't produce the drugs. And then there are user supply and demand challenges. So these were cross-cutting barriers for all the 13 drugs and commodities. The Commission came up with 10 recommendations in 3 strategic areas. So the strategic areas identified were looking at improved markets for life-saving commodities, improved national delivery of the commodities, and improved integration of the private sector and consumer needs. And 10 recommendations were made in this respect. Let me just take, wow. Oops. Wow, okay. All right, can you put it just back on slideshow? No, go up again. Yeah. Okay, there you go. Yeah, there, that one, yeah. Okay, yeah. Let me just take a minute to go through the 10 recommendations, because I think they're important. You may not remember them, but the slides will be available to you afterwards. So the 10 recommendations are very much shaped around how we shape the global markets, how local delivery markets are shaped, and just to emphasize that the recommendations look at global issues, they look at national issues, but also they look right down at the local issues around innovative financing, quality strengthening, regulatory efficiency, supply and awareness, demand and awareness, reaching the women and children, performance and accountability, and product innovation. So 10 key recommendations produced by the Commission. We have brought copies of the Commodities Commission, the recommendations, so they're outside, so you can actually read more on these different recommendations. Now, moving on to implementation, the Commission actually produced the recommendations in September last year. What does it mean? We're now moving forward to actually implement those recommendations. The 23 working groups have been set up, looking at the commodities. So we have working groups looking at each of the specific commodities. And as I said, we have the sessions in this particular conference that address the newborn commodities. The heads of those working groups are here. And then we have working groups also on the 10 recommendations. And these are led by technical experts for change at the global level. So we had CEOs that were the commissioners, but in moving forward on the recommendations, experts leading the working groups to ensure that the work gets done. Here is a summary of the working groups and the different conveners, and I would just like to highlight the newborn conveners. You might not be able to read this, but I can, so I shall take you through them. For injectable antibiotics, this is led by SNL, Saving Newborn Lives, and that is Steve Wall. Steve, are you here? Yeah. There he is at the back. Ask him any questions you want, he'll answer them. For antenatal corticosteroids, Save the Children, Bill and Melinda Gates Foundation, and Save the Children. Joy Lawn, she's here now with the London School. Joel, where are you? Are you here? There he is, very tall gentleman. So please, he can answer lots of your questions. Chlorhexidine is Path, that's Pat Coffey. Is she here? Oh, she's here, thank God. There she is. Yeah. So we're well covered here. And then for amoxicillin, UNICEF, but not me. He's there, and we have Chai. Is anyone here from Chai? No, but never mind. If you need to know anything, in this particular, no, actually amoxicillin is for child health. So we're well covered on the newborn health commodities. There we go. And just to remind you, the newborn commodities, the chlorhexidine, the bag and mask, the antenatal corticosteroids, and the injectable antibiotics. In October 2012, there was a meeting in Abuja to move forward the implementation issues, where we had ministries of health represented, and 8 pathfinder countries were identified to actually move forward and start implementing the recommendations within countries. The countries are listed there. What you see on the right is a declaration that was signed by the ministers of health of those countries, committing their countries to move forward as pathfinder countries. So please, all these countries are represented here. If you didn't know your minister's signatures on that paper, you need to actually do the work to implement the recommendations. Now, in moving forward on the recommendations, national leadership is the key element. The UN Commission was set up at global level to come up with global recommendations. The implementation is a national issue, country-led, country-owned, and the goal of engagement at country level is to sharpen the existing RMNCH plans, to identify and prioritize key high-impact interventions for scale-up, and then to develop a concept note that outlines key catalytic high-impact, cost-effective interventions. Really, it's just to say that they're to identify what are the key issues they need to move forward, and what existing funding is there, and what are the gaps to the funding. To give the example of Nigeria, as one of the 8 pathfinder countries, what they did initially was to identify the burden of disease. What is the burden of disease, the major causes of mortality, and based on that, look at what are the priority interventions. Which interventions, if you scale them up, could make the biggest impact. Using the list analysis, the life-saved analysis. I don't know if we have a session here that actually looks at the life-saved analysis, but in countries you might have already used this particular analysis, which shows you where you get the biggest bang for your buck, so to speak. And then looking at that, what are the priority commodities that could actually support that? So for example, in Nigeria, they identified that the priority commodities could be ORS, zinc, amoxicillin, the dispersible, and chlorhexidine, and they decided that they needed to rapidly increase access to and use of these particular commodities. And also they identified that they were going to focus on local market shaping and on access and demand. Nigeria has a lot of, I'm sure we have Nigerians here and they'll back me up, they have a lot of private sector companies that can do the pharmaceutical issues, so they wanted to look at locally how they could do the market shaping, but also importantly, focus on access and demand within the country. And I just want to brought in this slide because there's actually a skills building tonight that looks at this particular tool that we've worked with a range of partners to develop, because the Commodities Commission was set up to move the issue of commodities, but commodities are not scaled up in isolation. If you don't have a strong program, you cannot get the commodities alone to make an impact on maternal and newborn health. And so the first process really is for countries to do a landscape analysis of their RMNCH program, which includes the commodities issue. And this just shows the cycle of how you go through to identify the priority geographies and populations, look at the high impact interventions, what are the possible commodities that could support those interventions, and really then move to sharpening your national plan. So again, very much in line with Every Woman, Every Child, and also very much in line with the Promise Renew. The aim is to sharpen your national plan, to identify the gaps. And as you can see, all of this is really supported by strengthening partnerships and also strengthening social mobilization around reproductive, maternal, and newborn health and child survival. So just to summarize the work of the Commission, in September 2011, the UN Secretary General asked the executive directors of UNFPA and UNICEF to organize a commission to respond to the issues of lack of commodities and supplies for women and children. In 2012, the commission was launched. In September 2012, we had Goodluck Jonathan and the Prime Minister of Norway actually hand over the report of the Commission to the UN Secretary General. What's nice about the commissions are that they're short-lived. They're not meant to go on forever. They're supposed to come up, look at the issues, and come up with recommendations. These were launched in September 2012. In October, there was the Abuja meeting, where you saw the signatures of the 8 Pathfinder countries that have committed to moving the issue forward. And then now, from November 2012, we've had planning and action within countries. The 8 Pathfinder countries are moving forward on issues. Just before I end, I wanted to say a little bit more about funding for these issues. An RMNCH fund has been set up. The purpose really is to mobilize catalytic funding for national RMNCH strategies. This fund is currently hosted by UNFPA with a secretariat housed at UNICEF. We have support staff from WHO, monitoring and evaluation staff based in WHO in Geneva. In UNFPA, we have finance staff, and in UNICEF, we had the head of the secretariat and also communication. The current head of the secretariat is managed by Pascal Baileyveld. He's just been identified. It's a very new commission secretariat just been set up. It's not a big secretariat, a small group of people, not to do the work, but help to coordinate and to support. And there's a steering committee has been set up to advise donors how they should direct their funding based on analysis by the Commission working groups, based on the H4+, engaging with countries, and the IHP+. The funding decisions very much are to respond to governments and what governments want and what national needs are. Next steps, in April 2013, that's this very month, the government of the pathfinder countries are finalizing their sharpened national plans. The steering committee is meeting actually tomorrow, and that's one of the reasons why Geeta cannot be here. She has to fly back to Washington for this meeting. And then they are harmonizing the work, because I know many of you say, oh, we have all these different initiatives, we're getting confused. We want the RMNCH fund to try and harmonize the Muskoka, the H4+, FP 2020, A Promise Renewed, Commission on Accountability, so many commissions, so many initiatives, but all for a very good cause, the cause of women and children. And in June 2013, the 8 Pathfinder countries, the Ministers of Health, will meet in Dakar to share their best practices and progress, as they had agreed in Abuja. Ladies and gentlemen, thank you very much for your attention. If you have questions, you know who to ask them. Thank you.
Thanks, Kim.